I guess at least above the conversation. But we'll see. I'm so tired and I'm so early. Just waiting. I'm so bored and I'm so tired.
I'm gonna be meeting with you today.
Awesome. Nice to meet you.
You too. So this is, unfortunately I'm gonna be asking you a bunch of things that the tablet asked you, that Alex asked you, all that stuff, but we'll whip through it. Typically, I just document everything that's going on with you, and then I show you a video that tells you exactly what we do here.
Okay.
We're very specific with pelvic vein disease. So it's Dr. Spencer who started this practice, kind of going through all the things and the treatment and all that kind of stuff.
Okay.
And then we talk about it. I don't really have a medical history here.
Mm-hmm.
What are your chronic medical conditions?
I have gastroparesis, EDS, mast cell activation syndrome, lupus, and I feel like I'm forgetting one. Yeah, those are the main ones. Endometriosis.
And past surgeries?
Laparoscopy, endometriosis excision. That was the same surgery in 2024, and then an upper endoscopy in 2024.
Did they find anything in the upper endo?
Just a lot of stomach inflammation and Barrett's esophagus.
Are you taking any form of birth control?
My Fembry, it's like a chemical menopause. I don't know what else they call that.
Is that MY?
Yes.
FEMBRE?
EE. Yep.
BEE. These questions are related to anesthesia if we ended up doing a procedure.
Okay.
So just stop me if something's a positive.
Okay.
Hypertension, chest pain, heart attack, heart valve problems, born with a hole in your heart, previous echocardiogram.
Yes.
Was it normal?
Yes.
Irregular heartbeat.
Yes.
Tell me about that.
I have POTS.
Heart failure, shortness of breath.
Shortness of breath.
Can you walk up a flight of stairs?
I can. I usually avoid it.
Asthma, emphysema, or sleep apnea?
Asthma.
Girl, you left some stuff off your medical history.
Yeah, it's long.
Anything else?
SMA syndrome. I'm really positive that that's it.
It's okay.
We'll find out.
Stroke or seizures?
Seizures.
All right, here's another one. Tell me about that.
It's been maybe 4 years now. They've definitely decreased. I maybe have them like once a month now.
What is your diagnosis?
PNES. They did like one EEG and kind of left it there. It's also hard to like differentiate from a POTS episode and a seizure for me.
Okay. Any craniocervical instability?
Not that I know of. But I do have arthritis in my neck.
Okay. Weakness or numbness?
Yes, both. Usually extremities and limbs.
I think she documented most of your positives on the review of systems.
Okay.
I'll just confirm fatigue and weight loss. You wear glasses. Palpitation, shortness of breath while walking. When lying flat as well. Abdominal pain, difficulty swallowing, heartburn, pain when you poop.
Mm-hmm.
Do you have hemorrhoids or indigestion?
Indigestion.
Any rectal bleeding or vomiting blood?
No.
Do you don't have periods then with the February?
Mm-mm.
Any burning with urination or urinary frequency?
No.
Cold intolerance and heat intolerance?
Yep.
Any bleeding tendencies or enlarged lymph nodes?
No.
Okay, for your meds I have montelukast,
Mm-hmm.
fexofenadine. What is that?
An antihistamine.
Okay.
Allegra.
Okay. Vyvanse,
Mm-hmm.
naltrexone, famotidine, Zofran,
Mm-hmm.
Trintellix,
Yep.
magnesium, zolpidem, cyclobenzaprine, Nurtec. You get migraines?
Yep.
Pregabalin and Myfebri.
Yep.
Do you have any allergies to contrast dyes or to metals?
Nickel. I used to, I always get a rash when I wear fake jewelry. But no contrast dyes.
Okay, we have a CT of your abdomen, so she did look at that. And this is what the radiologist wrote, Dr. McDermott.
Mm-hmm.
The C angiogram is not timed to best evaluate the veins. However, I can see that she has severe compression of her left renal vein with pre-stenotic dilation as well as enlargement of the draining lumbar vein. Her gonadal vein on this side seems to have an unusual takeoff arising from a cluster of veins near the inferior aspect of the kidney, but it does not appear enlarged or tortuous throughout the course down towards the pelvis. However, this imaging does not actually include the pelvis itself, so I cannot comment on varicose veins in the pelvis. It is a little bit difficult to assess the iliac vein due to the timing of the contrast, but there is likely a compression. On sagittal images, there is not an obvious compression of her celiac artery, but she definitely has a very acute angle, and if she has upper abdominal symptoms, I would not be surprised if there is some degree of SMAS. I think it would be helpful to either get the MRI, if we are able to do so. I don't know. I think she was trying to say, get the MRI. We like to order for you to do so, because she can't see where the iliac bifurcates. So she does say, so she will need a formal MR venogram, which is an MRI with and without contrast.
Mm-hmm.
Depending on her most bothersome symptoms, we may decide, I think they dictated this. Depending on what her most bothersome symptoms are, that may decide which route to start her first with her. That'll make a little bit more sense once you watch the video.
Okay.
But I would like for you to tell me, in terms of I don't know if you know anything about Thurner or nutcracker or vein compression in the pelvis, but what would you say your three most bothersome symptoms are, sort of relating pelvic-ish?
The big one, especially recently, has been this squeezing, hammering bone pain that I get. It runs down my leg bone, but starts at my pelvis. Yeah, it just feels like someone's holding onto it really tightly and chiseling.
Which leg does it run down?
The right. Sometimes I get on the left, but the right is the worst and most frequent. It kind of feels like shin splints, but higher.
Okay. And that's daily?
Yeah. And then I would say just general pelvic floor tension, which I am starting pelvic floor therapy, so we'll see how that goes. But yeah, just tightness. I don't really get relief from laying down or sitting up, or heat, like baths and heating pads will work for a few minutes, but otherwise it's pretty consistent. Third, probably back pain by my SI joint.
Is that constant?
Yes, but the severity, like, wavers.
And how many years have you had these symptoms?
Since I was like 9. They've gotten worse the past, I'll say, 3 to 4 years.
Do you ever have involuntary movements?
Not like jerking, but spasms all the time.
Do you have a needle phobia?
No. That would suck for me.
Well, I'm sorry your anatomy is so uncooperative.
Thank you.
That is very difficult, especially when you're 21.
Mm-hmm.
You have all this stuff.
Mm-hmm.
So I think you're going to really relate to this video.
Okay.
And so I'm going to show it to you first, and then we'll talk about everything. Our medical records people are like, they're kind of saying you should. They're kind of saying, well, we want the patient to call Kaiser and request them because they're not responding to us.
Yeah, they left me a voicemail, so I immediately called Kaiser, finally got a hold of them, and then the lady, I guess who works in radiology, emailed me the release form. She was like, you can either burn a disc, or I could send this to you and send it back.
And you send it back?
Mm-hmm. Immediately.
Okay. So, then let's just wait a bit and see if we get it.
I thought it was crazy that I couldn't get it though, because everything at UC Health, I can see all my stuff.
Yeah, I know.
I got to see my gastric emptying, I see all my CT scans, and
so maybe follow up with them in a few days.
okay. I definitely can do that.
And I'll have medical records do the same, but they're just like, oh, can't get wrong.
It's just so crazy.
Yeah.
Because honestly, if somebody wanted my imaging, you can have it. What are you going to do with it,
Yeah, and we send them, medical to medical, we send them the request.
Mm-hmm.
And, but since they're their own entity, they can kind of just blow us off.
Mm-hmm.
So I'll just place the order to Health Images.
Okay.
And then if we don't get it in the next few weeks, if neither of us have luck, then at least you have an order for our MRV with our protocol.
Okay.
Well, let's see what your imaging produces.
Okay.
And are you on any medication for your lupus?
No, I stopped it last summer.
Okay. How is that doing?
I'm actually in a flare right now.
So, next step, I think we should just go ahead and schedule a telehealth appointment for a month.
Okay.
And I would say, let's give Kaiser a couple weeks. And if we don't get imaging from that, you can call here and see if we've gotten the imaging, ask for medical records. And if we don't have it from them and you're having trouble, then that'll give you time to get the MRI at Health Images and for Dr. McDermott to look at that.
Okay.
And make her impression or dictate her impression so that she can see the iliac vein better, because that's the main Thurner part that is the main low back, leg, pelvic symptomatology.
Okay.
And then we can do a telehealth visit in a month to review either their MRI or, you know, the one you have, a new one that you have done.
Okay. Awesome. I made it back home. Let's have a little debrief, shall we? That's gonna have to be good enough for now. I'm sitting on my step stool because I have outside clothes on and I can't contaminate my bed. Gosh, first of all, I feel so disgusting. I didn't sleep last night. I don't know if I've said that already. So much tummy trouble from that daggone sandwich, and my meds just were not doing anything for me. I kept waking up, I kept tossing and turning. I woke up at midnight, tossed and turned until 12:30, and didn't go back to bed until 2:30. Slept for a little bit, woke back up, was up. It just was sickening, and then my alarm went off at 5:30 because I had to be in Denver by 9 a.m. for my appointment. Well, you guys heard all of that conversation. I'm gonna leave pretty much almost all, if not most, of that conversation in, because nothing feels too personal or confidential or anything. I don't necessarily know. Hold on. 8 trains, 4 tracks, 1 station. On top of not sleeping, which me not sleeping is contributing to this, but my lupus, I just can't. I feel there's something about autoimmune diseases, not all of them, but at least many of the ones that I have, that you can just tell when your body is trying to kill itself, and it's miserable. Drive back was like an hour and 40 minutes, and I was able to doze off a few times, but yeah, I think that also made it worse. It's why I'm big on not taking naps, or I have to keep strict parameters around my naps when I am super inflamed or in an autoimmune flare, because for whatever reason, sleeping, and particularly disrupting my sleep cycle, especially without completing a full REM stage, just wreaks havoc on my body, and my brain just feels so insane right now. But yeah, my throat's not feeling too good. It's like really hard to breathe. All of my like joints are just so on fire right now, and my muscles really hurt, so that's great. Anyways, you heard everything that happened in the appointment. To summarize, it's confirmed already that I have nutcracker syndrome, and it's highly speculated that I have Thurner's, but they were waiting for my MRI from Kaiser to get sent over to them, to just fully confirm before we go through treatment. So the treatment for Thurner's is a stent. I'm not going to do the metal allergy testing. I don't feel like it's worth it to put myself through that. I mean, my body's going to accept it or reject it. And from what she's saying, especially about the research, I think it's just worth it to give it a try. And yeah, it makes sense that the receptors that are on your skin are very different from the ones inside your body. So if the scent is not touching my skin, I'm really not worried about the nickel allergy. And even having MCAS, like many of their patients have MCAS, and so they're super familiar with the holistic, multi-dimensional, multi-system side of things. And so I think it's worth trusting them. Yeah, I just had a really great experience at my appointment today. So potential stent, but we really can only treat one thing at a time, especially because I'm already getting a tube and I'm having my second endo surgery in April. So we'll go based off of which symptoms are bothering me the most, and from the questions she asked me and the things she told me, it sounds like the Thurner's is impacting me the most when I get that like squeezing bone pain, like someone's like chiseling at my hip, and even that SI joint pain is the most concerning. It also helps that I'm having the endosurgery in April, because I think I've said that other doctors of mine have speculated that I have endo on that muscle near my SI joint area. So Thurner's would be most likely what we treat first. That's why we need to push finding out and confirming that diagnosis first. And then where it gets complicated is the nutcracker syndrome treatment is not as simple as like putting a stent in. It would be basically the kidney version of the GI resectioning that one of my GI surgeons suggested for me. They call it a transplant. They call it some certain type of transplant, but it's not like a full transplant. I'm not getting somebody else's kidney. I don't remember if she said if they take the left or the right, but they take one, and I get to keep mine and reuse mine, but they basically reconfigure how it's connected to my other organs around that compression issue to help alleviate that compression issue. It's like the only way to do it. So again, that would be another surgeon that they would have to put me on their books to get done. So yeah, I don't know what I was expecting from this appointment today. I do think that I felt sure of a Thurner's diagnosis, but I definitely wasn't considering or thinking about anything else being positive or being wrong. So yeah, I kind of left with 2 diagnoses today, and on one hand it's like, wow, like what the heck, like how could my body possibly have another thing it's going through? And yet I'm not surprised, because my list is already very long. Like, you guys got to, I'm really, really glad that I recorded that appointment. You guys got to hear like the banter and like how difficult, and usually like I'll be looking at notes on my phone, but because I was recording I couldn't like see any of that stuff. And so I genuinely forget all of the diagnoses that I have until they keep asking me questions, and I'm like, oh, well oh yeah, I actually do have that, oh yeah, that actually does happen to me. So the fact that I got to capture that in real time was gold. But yeah, so add that to my list of things that we are figuring out. I think the only other scary / concerning / sad thing for me is the bigger sneak peek into how medical this year is gonna be. I don't know. I'm getting a tube today. I have endosurgery in April, and then getting a stent placed, and then possibly having my kidney re-sectioned, re-implanted. Yeah, it's weird. It's a lot to handle, and I really need a nap. I am going to get a shower. This huge zit on my forehead is driving me crazy. I did just squeeze at it again and get some stuff out, but it's out there. One of the ways I'm prepping is with throat spray. I took a little bit. I actually should probably read the directions. I haven't used this stuff since I was a kid. I use it every 2 hours. I probably used it like an hour and a half ago, but okay. Hopefully that's helpful. I'm not ready. I'm not ready for whatever this is. I'm not ready. I feel like I can't do this. And I know that I can, but I feel like I can't. This is so weird. Okay, so clearly I could not film in there
I mean, like, I probably could have, but just I was a little disoriented and didn't want to ask if I could film. My throat is so uncomfortable. The nose part actually doesn't even bother me. It's feeling like I have a bulge in the back of my throat, and it keeps, like, every time I breathe or talk or anything, I feel it move. I have a feeding tube now. This is so weird. Like, seriously, I can't. Wow. I don't know. Super weird, but it was a super fast process. Honestly, by the time I laid down on the table and the doctor came in, it was like maybe 15 minutes, if that. So super, super quick. It actually wasn't that bad. I think this part, like the aftermath and like having this thing like bouncing around in my throat, is what's bothering me the most. And then the lidocaine jelly that they used tastes horrible, and I mean horrible. I think actually the texture of chunks of jelly going, like, passing through my nose and going down my throat was more uncomfortable than the chemical taste. I also can't stop spitting. Like, I can't swallow it. Super gross, super fun, super spunky. I don't know why I just said that. I'm so tired. I'm on my way home. My friend Julia is in the store when the Kroger, well, it's not Kroger here, it's King Soopers parking lot, getting me some popsicles. And I'm gonna go home and chill. It's been a long day. 2 new diagnoses, a feeding tube, and it's snowing outside, but not even like real snow. It's like flurrying after it's been 60 degrees for 2 weeks. I can't wait to tape my face because it feels wrong. This is a bridle, so the blue things are magnetic on each side that go through my septum and like connect to each other so that this doesn't fall out, but it feels like it's gonna fall out. I feel super not secure. I think I'm gonna go home and try to tape it. I don't have any true dressing, but I'm sure Lauren does, so yeah, I'll check in later. I don't have any medical tape, so for now, there we go, that's better. I've been holding on to so much is happening right now. Like, nothing makes it more comfortable. Well, it just migrates. Okay. Oh, it's choking me. I also wonder if my, like, esophagus is having spasms. Anyways, KT tape. Singular piece. Now coming in handy until I can get actual medical tape. I don't know. This is just temporary, but yeah, that looks insane. Okay. Anyways, now that I have this secure, I need to call my surgeon and make sure that the order for home health care is being sent like ASAP. Okay, say hi to my new friend. She's so cute. I don't know what I'm gonna name her yet, but new addition to the collection. I am trying to do my meds and formula. Literally all I did was flush like 10 milliliters of plain water, and I was doing it standing up. Maybe that's mistake number 1, but it did not feel comfortable at all. I started to feel really sick. Yeah, because I don't have my pump, I'm literally just going super, 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 super slow. And I definitely won't finish a whole one of these tonight. But I did my meds, and of course the internet tells me that I should not have put all of these together, but my logic is if if I pop them all at once regularly, then they should be fine. But it's more so about like the tube clogging and stuff. So yeah, I am just trying to make sure it's like super mixed. This is like really fun, this part at least. I'm gonna do I flushed. Also, it still hurts so bad to swallow. I've never felt more expressive about my pain in my life. I'm gonna do my meds, and then I'm gonna wait 30 minutes, and then I'm gonna try to push some of this formula. It's already 10 o'clock for reference, so I don't know how I don't know exactly how much of this formula that I'm gonna get through, because I'm gonna start pushing. That means I would start pushing at 10:30. Also, you're way too close. Need some space. Lauren just left like maybe half an hour ago, and then I started doing this because I don't have my pump yet, and she has like enough like extra supplies. She was able to leave me with this stuff, so she left me with 3 syringes, 4 bottles of formula, and a bunch of gauze and tape, which total lifesaver, because yeah, the healthcare system obviously did not set me up very well. Oh my gosh, I'm so scared. I hope I don't clog my tube. It just it's uncomfortable going in just because it's obviously not like refrigerator cold, but it's cold and you feel it, and yeah, it's just like super uncomfortable. It like somehow makes me dizzy. And now that I'm thinking about it, I totally should have held off on putting the magnesium through here as well. I don't know what's left in this part of the syringe, but I can't keep going. It's like really nauseating. Yeah, I just need a break. Oh, please don't throw up, God, please. Frick. like 7 in the morning. I slept like butt cheek last night, but I will say also hyper aware of the fact that I slept better / more comfortably here than I would have at the hospital, so I was so grateful for that. Yeah, I just kept waking up like every like 15 minutes to like spit. At one point I woke up choking, needing to cough, and aware that I like am not allowed to truly cough because I don't want the tube to come back up. Yeah, I wasn't able to push any formula last night because after pushing my meds and just flushing, I felt so nauseous and awful. So I had to stop and just try to go to bed because I was on the verge of throwing up. Like, you know when your mouth salivates in preparation for the stomach acid that's about to come out? That's how I knew it was bad. So I stopped. I didn't push any formula and I am super shaky. I need to take my blood sugar, but I'm gonna shower really, really quickly. I know it's probably such a stupid idea with how I feel right now, but I cannot. I feel icky and I can't even think about recovering or pushing fluids or anything until I feel physically clean.